you think we will actually see this happen? I do want to ask really quick. This is important because there's a lot, like President Trump talked about this. He signed this executive order to make price transparency for healthcare, right? And for hospital bills and medical billing. And we talked about it last time you were on. You said your wife was giving birth and you didn't even know like how much it was costing. Like, what does this cost? And what if we get the amnesia? Or your wife's like, I don't want any amnesia or whatever. And you're like, you should take it. And you're like, how much is it? You know? But it's like, nobody knows, you know? And then they're putting $30,000 of amnesia in your wife. And you're like, well, shit. And so it's like, but what I'm saying is everybody at this point is but it's a $100 trillion, multi-$100 trillion industry that's going to change. Will we actually see it take place? Do you think we will actually see this happen?
I think it's going to take a little time, but we took the first big step when the president signed that executive order. And the president's attitude is, look, it's the right thing for the American people. So I think, again, it's an example of when you've got to tune out the financial pressures of politics and just do what's right. And I think that's a win-win scenario because you can't expect Americans to pay 10 times for prescription drugs what other people pay. It's also, by the way, not that this is the main issue, but it's bankrupting people and it's bankrupting our country. Because we spend so much more on healthcare, and that's a major driver of our budgetary problem.
It's the number one cause of bankruptcy is medical debt. They're afraid to get sick because they can't afford to be sick.